in the surgery world, there's a bit of interest, not as much as there should be, on patient education tools, patient decision aids, spelling out the risks of the surgery, spelling out the likely benefits. And often when that's done, patients are much less likely to want to have surgery. But I think unfortunately, a lot of it comes down to the therapist-patient interaction and your ability to be able to gain trust, have a good communication style, and be able to get this message across to them that, a lot of physios will overtreat, and they do. I know this. Everyone overtreats a little bit, and when we know the physio, they'll just keep you coming back, every week for 6 months, just doing pretty much nothing for you, and that's not the best way to treat you. And for most patients, the best way is for them to get better themselves, to build resilience, coping, strength, and the ability to withstand and cope with difficulties is the best way for patients to be treated, not just to sit back and have somebody else do something to them. They're better off doing it themselves. And unfortunately, that's the kind of, not just the kind of health system, it's a little bit the kind of society that we have as well. It's kind of like, well, I've got a headache. This is your problem now. Just
exactly,
you're the therapist. Just sort it out for me.
Yeah, it's interesting you mentioned that. We had Bronnie Thompson from University of Otago come on the show a few weeks back, and we were talking about chronic pain and how you treat that, and it all came back to that too, like self-management versus active treatments versus passive treatments, and this idea that patients, they do better in the long run when they learn to manage it on their own versus having somebody do something to them.
Upping the pills every month and doubling your morphine dose or something. That's the old way of treating people.